This is Dr. Jochen. I'm a board-certified dermatologist and a clinical professor at USC in Los Angeles. Today I'm going to talk to you about hair transplants. I have offices in Los Angeles, Newport Beach, Palm Springs, and Rancho Mirage. I was introduced to hair transplant surgery in my residency at Tulane University and was very excited about them right away. I trained with some of the best surgeons in the country to do this procedure, and the thing I love about it is that it allows me to combine art and science. The best thing for me is when I do a hair transplant on a person and it raises their self-esteem and they tell me, wow, this looks great, and nobody's been able to tell that I've had anything done cosmetically. There are multiple causes of hair loss, and the one that we do hair transplants surgery for is androgenetic alopecia. Some of the other causes of hair loss include telogen effluvium, scarring alopecias, Tinea Capitis, Alopecia Areata, traction alopecia, and trichotillomania. The most common cause of alopecia is going to be androgenetic alopecia. It accounts for 95% of hair loss. This type of hair loss is inherited from both sides of the family. Many people believe it's only inherited from the mother, but this is false. It's from both sides of the family. It's very, very common in men, and most of us know that. It affects 25% of men in their 20s, 40% of men in their 40s, and 70% of men by their 60s. Women also experience androgenetic alopecia at very high rates similar to men. However, they never have the same pattern or extensive hair loss that men get, or typically do not. Androgenetic alopecia in men is caused by elevated dihydrotestosterone, a hormone in the body. The typical pattern for androgenetic alopecia is going to be temporal recession or hair loss in the top of the scalp. So the temples is this area, and then the top of the scalp is over here. And it can be mild, or it can become very severe, where all you're left with is a horseshoe strip of hair in the back of your scalp. In women, they have a different pattern with androgenetic alopecia. Typically what you're going to see is diffuse thinning of the hair, but you may see more extensive hair loss in the crown or the top of the head. Telogen effluvium is the second most common cause of hair loss. This type of hair loss is typically a reversible type of hair loss. It has many causes, most of them medical, or it can just be caused by stress. The most common cause of telogen effluvium is going to be pregnancy in women, and this is caused by hormonal changes during pregnancy and then after pregnancy. It can also be caused by poor nutrition or crash diets. It can be caused by medications. It can be caused by thyroid disease or autoimmune diseases which affect the body. And some of the autoimmune diseases that might affect hair loss would be things like lupus or connective tissue disease. Infections also can cause hair loss. The most common cause of hair loss with infections would be secondary to fungal infections. This is called Tinea Capitis. We can also get bacterial infections which can harm the hair follicles. Alopecia Areata is an autoimmune disease in which the body's immune system attacks the hair follicles. This leads to patchy hair loss around the scalp. Traction alopecia is caused by tight hairstyles, particularly braiding. And you will see this frequently in African Americans who do tight braids in their scalp for long periods of time. The tension with traction alopecia leads to trauma to the hair follicle, which causes it to fall out. And this can lead to a scarring alopecia that is not reversible. Trichotillomania is a compulsive behavior where people pull or twist their hair repeatedly. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.